Why can giving the wrong blood type cause reaction in minutes? Hi everyone, I'm Beatrice. In this video, we'll be looking at blood group, antigen antibody, the ABO system, and the resource factor. This topic is very important before you can understand blood transfusion. In another video, we'll be looking at blood transfusion. And also, before the end of this video, we'll look at some questions that will test our understanding of this topic. So if you're ready for today's video, let's begin. Now, first, let's look at the blood groups. So when we say blood groups, it just means classification of blood based on the antigen that is present on the surface of the red blood cells. So for antigen, they are the proteins that are found on the surface of the red blood cells. For these antigens, we have antigen A, we have antigen B, we have antigen D, which is the resource antigens. Now we have two systems. The first one is ABO system and the resource system. For the ABO system, it groups the person's blood type as either blood group A, blood group B, blood group AB, or blood group O. The resource system classifies blood type as either resource positive or resource negative. So if it's resource positive, that means they have the antigen D. If it's resource negative, they do not have that antigen D. Now, for the antibodies, they are also proteins, but this time around, they are not found on the surface of the red blood cells. They are found inside the plasma. They are proteins that are there to attack any foreign antigen. You only make antibodies of what you don't have. Now, what I mean by this is, if you, for instance, your blood type is A, that means your antigen is A. Your antigen present on the red blood cell is A. You are going to make antibodies of the opposite. Since you have antigen A, you make antibody B. So, meaning you will have anti-B antibodies. Now, if your blood type is B, that means you have the antigen B. And that means you are going to make antibodies of what you don't have. You'll be making antibody A. So you'll be having the anti-A antibodies. If your blood type is AB, that means you have both the antigen A and the antigen B. That means you have both already. You will not be having any antibodies in your plasma. Now, if your blood type is O, it means 0. It means you don't have anything antigen. Meaning you are going to make both the antibody A and antibody B. Now, based on this explanation, let's look at why we have universal donor and universal recipient. For the first one, we'll be looking at it for the red blood cells, so for the antigens, because we also have universal donor and universal recipient for plasma. Now, for the universal donor of red blood cells, we have O negative. So that means O, blood group O, meaning you don't have any antigen A or antigen B. And we say negative, meaning you don't even have the resource factor. You don't have the antigen D factor. You don't have it at all. Because of that, you are a universal donor because you only have your antibodies. And when we talk about reaction or agglutination, it is antigen against antibody or antibody against antigen. Antibodies cannot fight each other. Remember, for RBC compatibility, it is donor's antigen versus recipient antibodies. Now, what's the donor's antigen? It is O. O does not have any antigen. The recipient antibodies can be depending on whatever the body produces. Now, because the agglutination or in terms of compatibility has to do with antigen versus antibodies for the red blood cells, the O does not have any antigen. So even when the other blood that is coming, the recipient blood, mixes with it, even if the recipient blood have antibodies, it has no antigen to fight with because antibody does not fight antibodies. So since there is no antigen to fight with, that's why O negative become the universal. The next one is AB positive. These are called the universal recipient. It's the same principle. They are universal recipient for this. Now, AB positive. First of all, the AB. It means they have antigen A and the antigen B, meaning they do not have antibodies at all. Now, it is also positive. That's because they have the antigen D, which is the resource factor present on their red blood cells. Now, why are they universal recipient? If they have both A and B antigen, that means they don't have antibodies. Look at the compatibility again. Donor's antigen versus recipient antibodies. The recipient is the AB. The recipient do not have antibodies. So even if the donors have all the antigens present, they don't have antibodies to fight. Antigen does not fight antigen, so they need the antibodies to fight. Now let's look at the universal donor and recipient for plasma, because some blood transfusion also involve transfusing plasma. We'll look at it in detail when we look at blood transfusion in another video. So we have AB, they are the universal plasma donor. So it's like the opposite. Now for plasma compatibility, it is donors antibodies versus recipient antigen. When we say AB is a universal plasma donor, the reason is because AB does not have antibody, so they can donate to anybody. When they donate, there's no antibody to fight the recipient antigen. Now for O, it is a universal plasma recipient. So what we mean by that is that O, remember O means there is no antigen at all present. So that means when we look at the plasma compatibility, we're only looking at donors antibodies versus recipient antigen. The O here does not have any antigen, so which is the recipient. So there will be nothing to fight. Now let's look at why the rhesus factor matters with a focus on D antigen. So for D antigen, they are going to make anti-D antibodies. Now, these anti-D antibodies, they are not naturally occurring, unlike the ABO system, where they naturally make the antibodies the opposite of what they have. For this one, when we say it's not naturally occurring, it only occurs after exposure. Like the body makes these antibodies after exposure, like in pregnancy, in blood transfusion. Now, let's say, for instance, a woman is pregnant, the mother is pregnant, and she's negative. She doesn't have the rhesus factor, the D antigen. And now the baby in utero has the D antigen, maybe from the spouse, the husband. Now, what happens is that that first baby will be safe, but for subsequent pregnancies, the body of that woman is going to make antibodies. It's going to make the anti-D antibodies for subsequent pregnancies. So this can lead to what we call hemolytic disease of the newborn. When she conceives again, the red blood cells will attack each other. The antibodies is going to fight the antigen. And when it happens, it leads to excessive breakdown of red blood cell in that fetus. Now, for future pregnancy, to prevent this, they give them what we call Rh immune globulin, which is ROGAM. They give this injection to prevent that agglutination, to prevent hemolysis in that newborn. Finally, grouping and cross-matching. When we just say grouping, we're just saying lab test that is used to identify the blood type you belong to, and also the rhesus, your rhesus status, whether you have the rhesus or you do not. Now, for the cross-matching, it is just to check whether the donor's blood is compatible with the recipient's blood. Now, let's look at some questions that will test your knowledge on this topic. Question 1. A nurse is caring for a pregnant client who is rhesus negative and has a rhesus positive fetus. Which intervention prevents the development of anti-D antibodies? A. Administer Rh immune globulin during pregnancy. B. Transfusing rhesus positive blood after delivery. C. Avoiding all blood transfusions. D. Monitoring antibody titers only. The best answer will be A. That is the Rh immune globulin, which is also what we call ROGAM. It prevents sensitization by destroying the rhesus positive fetal red blood cells before the maternal immune system can form the anti-D antibodies. Question 2. A patient with blood type AB positive requires an urgent red blood cell transfusion. Which blood type can the nurse safely administer? A. O negative, B. A positive, C. B positive, D. All of the above. The best answer will be D. Remember, the AB positive patient have no anti-A, anti-B, or anti-D antibodies, so they are universal red blood cell recipients. Question 3. Which patient is most at risk for developing anti-D antibodies? A. A rhesus positive patient receiving rhesus positive blood. B. A rhesus negative patient receiving rhesus negative blood. C. A rhesus negative patient exposed to rhesus positive blood. D. A newborn with type O blood. The best answer will be C. A rhesus negative patient exposed to rhesus positive blood. The reason is because rhesus antibodies, they are not naturally occurring, so they only develop after exposure to the rhesus D antigen. Question 4. During cross-matching, agglutination occurs when donor red blood cells are mixed with recipient plasma. What is the nurse priority action? A. Slow the transfusion rate. B. Notify the provider. C. Do not administer the blood. D. Administer antihistamine. The best answer will be C. Agglutination indicates that the blood is not compatible, so the blood must never be transfused. So that wraps us today's topic on blood group, antigen, antibody, rhesus factor. If you find this video helpful, please like, leave your comments, share this video, and subscribe for more educational videos. Thanks for watching.